balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 154. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Eisenstadt, IBCLC, and I help moms with breastfeeding. For today's FAQ, we're going to focus on a question that I am asked many times, particularly during the cold and flu season. My inbox is filled with the same question. Do I need to stop breastfeeding if I get sick? I will begin by saying that it's a rare illness that will require a mother to stop breastfeeding or stop breastfeeding temporarily or pump and dump her milk. The risks of not breastfeeding almost always outweigh the risk to the baby of breastfeeding. I'm going to read directly from the most current CDC Guidelines dated November 2016. I will provide a copy to this link in the show notes. This is important to note because things do change from time to time, and since this podcast will be heard for many years to come, it is very important for me to make this distinction in the event that this critical information changes, and in addition, you should always speak to your physician about any of these following conditions. Breastfeeding is not advisable if one or more of the conditions is true. An infant who is diagnosed with galactosemia, a rare genetic metabolic disorder. The infant whose mother has been affected with HIV, is taking antiviral medications, has untreated active tuberculosis, is infected with human T-cell lymphotropic virus type 1 or 2, is using or is dependent upon an illicit drug, is taking prescribed cancer chemotherapy agents that interfere with DNA replication and cell division, is undergoing radiation therapies. However, such nuclear medicine therapies require only a temporary interruption in breastfeeding. The conditions I just listed will require you being advised by your health care professional. They may have another decision on this topic. For most other medical conditions, I would say that the risks of not breastfeeding almost always outweigh the risks to the baby of breastfeeding. Basically, what this means is that it poses a greater risk to your baby when you stop breastfeeding when you get sick. And I will elaborate on this in a few minutes. What are parents' greatest concerns? Well, understandably, you're concerned that if you get sick, your baby will catch whatever it is that you have. Of course, the last thing we want to do is for our babies to get sick. But our bodies are pretty darn amazing in helping to protect our babies. While I know this information, and I talk to parents about it frequently, when I sit quietly and think about this, I am continually amazed. Here is how your body handles illness and how it protects your baby. Before you even knew that you were sick, you were already breastfeeding your baby, right? Which means that your baby has already been exposed to whatever virus or bacteria that made you sick, right? Makes sense. When you became sick, your body went to work. It began producing antibodies to fight your illness. Antibodies are like special cells of the immune system, which can recognize organisms that invade the body, like bacteria, viruses, and fungi. These special cells are then able to set off a complex chain of events that are specially designed to kill these foreign invaders. These antibodies go right to your baby directly from your milk supply. And that's what I mean when I sit quietly and just contemplate how amazing our bodies are and how capable we are of keeping our babies healthy. Our bodies respond to our illness and bring out fighter cells that kill off the bad guys. How amazing is that? This is exactly the reason you want to keep breastfeeding. The antibodies are like medicine to your baby. You have the medicine that your baby needs. And the last thing you want to do is take away your baby's medicine. Now, this does not provide 100% protection. However, the likelihood of your baby catching whatever illness you have is greatly reduced if you keep on breastfeeding. And we find that even if your baby does get sick, it will usually be a much milder, short-lived case. Being a mom makes it hard to avoid contact with your baby, but you can take simple, special precautions such as hand washing on a regular basis, as this can reduce the likelihood of transfer. While it may be safe for you to continue to breastfeed your baby during your illness, you may feel so badly that you're having a hard time doing so. Caring for your baby will be easier if you tuck your baby in bed with you and have others help you by keeping you with a steady supply of fluids, water, whatever light food you can keep down. If your baby does get sick with a cold or flu, the breastfeeding may be affected. Your baby may still be hungry and still thirsty, but they're having a difficult time breastfeeding with a stuffy nose. When your baby forms a good seal around your breast tissue, which they do in order to breastfeed, this can make it more difficult for them to breathe through their nose. Because of this, you may notice your baby breastfeeding for shorter periods of time than usual and more frequently than usual. And this is totally fine. It's actually a good thing. Babies who have ear infections, they are sometimes uncomfortable and in pain. And the suction your baby creates when breastfeeding, it can make their ears hurt a little more. So again, they may have shorter, more frequent feedings. You may notice that your baby breastfeeds shorter periods of time, but absolutely goes more frequently. I'm going to say this again because it's helpful for us to hear. Your baby may breastfeed for shorter periods of time, but perhaps more frequently. This is not uncommon when they have a cold, they're stuffed up, their throat hurts, anything hurts, their ears hurt. They may get as much as they need throughout the day, but in shorter time spent at the breast. Now, once they start feeling better, they should not keep up that habit. They should go back to the usual way that they were breastfeeding. Perhaps your baby begins to lose interest in breastfeeding, perhaps because of a fever or pain or a belly upsetness. If you feel stuffiness is the issue, you can try breastfeeding in a room with a vaporizer. If this does not help you, you can try going into the bathroom, turning on the shower, and breastfeed while the shower is running, as the steam may help reduce the stuffiness. And for me, with my kids, that worked wonders. That was my go-to. Go to the bathroom, put a nice towel on the floor, turn the shower on, heat everything up, have the bathroom well steamed, and it just made it easier for my baby to breastfeed. If you feed your baby frequent and short feedings, you'll probably avoid her from getting dehydrated. So I don't want you to be concerned again about those frequent feedings, but it is helpful to know the signs of dehydration. So I'd like to remind you of some of them. One is you just start to notice that they're acting differently, less energetic, a cry but it's kind of getting weak, and less than usual pee diapers. You may also notice the fontanelle, or what we call the soft spot on your baby's head, begins to look sunken in or depressed. She may have dry eyes or a dry mouth. When you pinch her skin, it stays pinched looking for a longer time after you gently pinch it. A clean finger in your baby's mouth reveals a dry mouth like sandpaper. Now, all of these symptoms, if you feel like your baby is getting dehydrated, you will want to call your physician and discuss it with them. You also will want to keep breastfeeding. If your baby is refusing to breastfeed, you absolutely want to call up your physician. You can try hand expressing your milk and try several ways to feed it to your baby. Some babies will be able to spoon or cup feed well. Some will do better with a syringe. You will need to do what you can to offer frequent feeds to keep your baby hydrated. You will need to keep removing the milk by hand or a pump to keep up your supply, at least until your baby is feeling well enough to breastfeed the usual times of day. So moms get themselves into trouble when their babies are sick. They're sometimes afraid to feed them so frequently. They think that there's something wrong with that. And they also don't realize that if the baby is having a hard time feeding and is not doing a great job, that they do need to get food into the baby perhaps another way, and they need to remove the milk because otherwise your body will get the impression that it doesn't need to make so much milk and it will slow down the volume. It really can be quite trying and tiring, and it is common to feel somewhat anxious when your baby gets sick. Anytime you or your baby are sick, it's recommended to call both of your physicians and speak to them about specific care. Please take note of all the information shared with you and know that unless there's a specific medical reason to do so, you should continue to breastfeed or offer your baby milk during the illness. If at all possible, now's the time to ask a special someone to come and help you out. Perhaps it's your significant other. They can take off for a day or two. It's a mom or a mother-in-law or a good friend. But it really helps us to have someone in the household when we are sick. And sometimes even when the baby's sick, because they frequently may not even let you put them down for a minute for you to grab something to eat or a light nap. So don't be shy about asking for help. The other thing that I wanted to mention about when babies get sick, that when I said the risks of not breastfeeding almost always outweigh the risk to the baby breastfeeding. And this is because some people, what happens is that they're told that they cannot breastfeed. And so they start pumping their milk and dumping it because they're sick. Well, again, remember what I said about the antibodies. The other thing is sometimes moms are told to pump and dump and they don't have any extra milk. And now they don't have any donor milk, and the only choice they have is formula. Well, if your baby is a month or 2 or 3 or 6, and you start to introduce formula to their GI system, you might have a problem with that. They might squawk on that. Their bellies might ache. They may vomit and just not really do well with that formula. So you really want to find out that the medication that you're taking or the illness that you have, that it truly means your baby cannot have your milk if that's what you're told to do. As always, you will find the links that I have referred to in this podcast in the show notes. A good accompaniment to this show is episode number 136, where I talk about breastfeeding and medications. You will also learn that most medications are safe to take while breastfeeding and how to find which ones are not safe. All you need to do is go to allaboutbreastfeeding.biz/podcast, and under episode 154, you will find the notes for today's show. I look forward to sharing some more great information on breastfeeding and moms and babies in our next FAQ show next week. Until then, bye-bye. Have you heard that Phoenix, Arizona is blessed with an amazing birthing center? Baby Moon Inn Birth Center is the best option for families who want access to midwifery care in and out of a hospital setting. You can experience birth in a comfortable home-like setting where natural birth is the focus. Laboring in water, being able to walk outside during labor, and enjoy the beautiful garden. This is what birth can be like for you. There is so much more to learn about Baby Moon. The staff would love to have the opportunity to meet you and would like to extend an invitation for you to attend a free Choices in Childbirth class and a tour of the birth center. All you need to do is call 602-314-7755. That's 602-314-7755 and ask for the tour dates. You can also go to allaboutbreastfeeding.biz/podcast. And on the right-hand side of the page, you will see a link that will bring you to the calendar and you can sign up for the tour yourself. When you come in for the tour, make sure that you tell them you found out about it from the All About Breastfeeding podcast, and you will be given a very lovely free gift.